Well, that's no good.
Yeah, what's changed is after about 3 days, I was able to start walking again.
Yeah.
But it took about 3 days. Is way Dad.
Steroid takes the peak dose of the steroids 3 to 10 days.
Yeah.
So then it's really working, and if it gets the inflammation down, then it will help you keep walking and going.
It seems a little better. I mean, it's not constant like
It's
what
not
it was.
perfect.
Not, let's say nagging. It's not nagging from,
It was pretty bad when you came in because
Yeah.
it seemed like when you would walk, you'd have the, like.
Oh, I still do.
Do you?
Yeah.
Yeah.
Yeah. Okay.
If you wanted to
Let's get over here.
look at this, this is your surgery. This is fluid around your sac.
That whole white area?
Yeah, that's spinal fluid.
Oh,
that's
okay,
normal.
okay.
But as you get down here, you can see this where he did surgery, so you don't see the nice.
Yeah.
Okay, so you get down here, you start to see here's a little bit of fluid.
Okay.
Right, and this is your spinal column in the back part.
Okay.
Do they have is the only spine? You don't have a carry spine, huh?
There was one.
I've got the model in the office.
Well, is it a carry one or the one that rolls on the?
Well, I can take it off the rack.
Okay, yeah. If he has any questions, then we can. But anyway, when you get down here, this what we want you to see. This is fluid.
Oh.
We looked at it in the STIR image, and he's gone there and worked on around the spine.
Right.
But and this is all fluid here.
All that white area?
Yeah, and I'll show you. This line, when I move it right there, then you can see it here.
Oh my God.
Yeah.
Oh my God.
Yeah.
And
so,
that's 3-4, right?
This is
or is that 4-5?
This is 4-5, and I think he did. What did he do in injections on you? Or I mean surgery.
He did laminectomy on.
Well, I know
4-5.
you had 2 level. I couldn't remember if it was 3-4, 4-5, or 4-5-5.
4-5.
Yeah.
And then he did 4-ramo, worked on the ramo opening.
Yeah, that's where the nerve comes out right here. You'd see it right there. There's the nerve coming out.
Okay.
You can see you've still got some disc on it.
Yeah.
Where it's pushing on it. So you've got, and that could be what's causing you that. But I don't want to do anything on your back.
Right.
Till I know what this is.
Right.
Because, I don't want to go in there and rupture a cyst, or if he's going to tell you, well, that should heal and go away, we'll
deal with it.
Yep, go from there. And this is your, you have these Tarlov cysts. That you've had those before, and they're not increasing in size.
Okay. Yeah.
But I would have that looked at because, we want to know what it is.
Right.
If he thinks it's healing,
right,
and because that's their expertise. Does that make sense?
Right. Okay. So now let me ask you: all this area here is the fluid. Mm-hmm. Is that right?
Yep. You can see it's about 4 millimeters wide. And it's about 4 millimeters wide, and up here it's probably 6 millimeters wide. And see, up here, did you see this view where it's real? That they actually took, went up. This is going clear up by your spinal column. Yeah. See, and what I don't want is if he thinks it's a pocket. You haven't had fevers or anything like that. Yeah, good. Okay, but he'll probably. I don't think they will do much. But someone needs to follow you.
Yes.
Where you know about it.
Yeah, and I like that anyway because I'll tell you what. That's if I press back here and when I have pain, that's exactly where it's at.
Well, yeah, and that's why I wanted to get the MRI because if we were going to remember, we talked about doing facet testing for the arthritis.
Right.
I don't want to do it with that.
Right.
Because I will puncture it, and if it's
something bad.
If it's something bad, it leaks out. And,
that's when infection would come, huh?
Yeah, that's why we wanted to get the MRI.
Yeah. Boy, that's a lot in there. Or is it?
Yes. I'm not going to say it's a lot.
Right.
But it's significant.
Significant amount.
It shouldn't be that much now.
Right.
You know, and maybe it's being absorbed and we haven't seen it and it's improving. We don't know because we're just taking a shot in time.
Yes.
So, but he'll be the one who will go, you know what we'll do? You're fine. We'll order an MRI for a month or 2 months
Right.
and we'll look at it. If you
Right.
get a fever, come in. We got to figure out what to do.
Right.
Okay. And he looked at the stir images and stuff, which I'm pretty sure it's fluid because it shows up on the stir image. It's not fat or it's not, you know, stuff growing in there. It's fluid.
I've been
pretty
eating a lot lately, like pie and stuff like that. You sure it's not fat? You sure?
I'm pretty sure.
I can feel this going up, but you know, yeah.
No, that's this here.
Oh my! Oh, is that guy pregnant or
Yeah.
what?
No, he did. There's no baby. So, anyway,
right.
we'll write that referral, and then
Yeah.
once you see him, if he doesn't do anything, we'll talk about doing facet testing on your back. But right now, we couldn't.
Right.
I mean, because this is right.
Right,
You know,
right,
where we
right.
want to put it. It's actually medial from where we want to put the needles, but I don't really want to mess around with your back when all that's going on. Okay.
Can you go back one
Yeah.
there? Can we look at that one?
Yeah. Well, this is a coronal image. This is the one we were looking at right
Yeah.
here.
Can we look at that second one though? Because I can see my tire lobes in there. That,
Oh, yeah. Here.
where I was standing up there or whatever.
Yeah, it's a coronal image. You're still, so it's taking it.
Yeah, that guy.
Yeah.
So right down here is the tire lobes, right?
Yeah, in the
Right
sacrum.
there.
Yeah.
And they haven't grown.
No, and see how they look like the spinal fluid? This fluid looks different.
Right,
See that?
right. It's a lot brighter.
It's a lot brighter, which makes me think it's a cyst. Yeah, a lot more water, not necessarily on the stir image as much, but it kind of tells us it's not just spat or
Right.
something like that.
Right.
It is fluid.
Steve, I got to ask you now.
Yeah,
Over 2 years ago,
2 years ago.
2 years ago, I got in an accident in an Uber. And
Okay.
what happened was the guy, we're coming home from a show, and he ran over the curb, and there's a big hole on the other side of the curb.
Mm-hmm.
And so I went up there and came back down, bam.
And hit your...
Yeah, and that's when all this stuff really started. I had hip pain before that.
Yeah.
Okay, and I was treated with, like, you know, kind of like what you did the other day for the hip pain.
Yeah.
But when they did a CAT scan on me, they saw that the 3/4 disc had bulged, and that was the first instance that, you know, I had.
Had you had
heard.
an MRI before that?
No.
Yeah. There's no way to know. I mean,
Okay.
could it have caused it? Yeah.
Could
But did it? I don't know.
Yeah, and as far as the causation goes, you know, not necessarily caused it, but aggravated it. Is kind of what I'm wondering.
Yeah. There's no way to know that.
Right.
But obviously it could.
Everything just
You
went
know, yeah.
like that from that point.
Yeah. The trouble is, you know, when anyone our age, where you go in and look at their back,
Right.
they've got bulges. The discs
Okay.
are drying out.
Okay.
We're having things that, you know, make us more prone to back injury. So could it have done it? Yeah,
Yeah.
could have.
Yeah.
And that's something that could hit it down and cause a disc to bulge.
Yeah. Yeah.
You
Yeah.
know?
Yeah.
Did you go in and with back pain after that?
I did. I started getting treatment down at the pain clinic down
Are
at
you still
Tri-State.
recording?
I am. Do you want me off?
No, I don't
Okay.
care.
Yeah, I started getting treatment down at Tri-State at the pain clinic.
Yeah.
And boy, I've had some real jerk doctors. I love you, but I've had some pretty, you know, I had a doctor down there that he wouldn't even give me the time of day. He wouldn't greet me or nothing coming in. And it's just
Well,
like a lack of respect, you know.
I think what you need to do is go see Dr. Blady, find out what the fluid thing is, and get
Yeah.
a treatment plan.
Yeah.
And then come back and we'll talk about what we can do to help you.
Okay.
That's what I would recommend. But we need to know.
Yeah.
Because it isn't, some people have fluid, especially you have diabetes and stuff. There's people who have fluid afterwards. But
After the surgery.
that's not my bailiwick. That's
Yeah.
his.
Yeah.
So you need to talk to a surgeon.
Yeah.
Okay?
I'll do
And
that.
then
I
we'll
would-
reappoint you.
Yeah.
All right.
I'm anxious to do that. Thank you so
Very
much.
good. Yeah.